talking about a patient that he saw twice over 5 days. 35-year-old man.
Mm-hmm.
He came in he had just had COVID.
3.5 weeks prior to his visit.
Okay. And following COVID, he had a shingles outbreak.
Correct.
Was one the result of the other? Do you know? It was?
Yeah, when you're sick, your immune system drops.
Okay.
And when your immune system drops, everything that your body's constantly fighting off can win the battle. And so it is a virus, a herpes virus. Shingles is chicken pox, okay? It erupted on the left side of his head. So it got the back of his left neck, the side of his left head over his ear and in his hair. And there was one little lesion on the tip of his chin, which is important.
Well, what caused and he sent us some pictures that I looked at, that left side of his face was not shaped.
Well, no, he also had a Bell's palsy, so he had a number of symptoms. So in our brainstem, we have 12 cranial nerves, and remember, the eye is part of the brain. The eye is brain tissue, and about 60, 65, 70% of the brain, you can argue it, is devoted to vision and how we see in all the little hookups between all the neurons and centers of the brain. So he had an immune problem because he had the COVID.
Right.
And then his body lost the battle to the constant battle of these. He probably had chicken pox as a kid, and this virus hangs out in these things called
that's the only way you
dermatomes.
can get shingles is if you had chicken pox, right?
No. And so that erupted on his head, and then he developed a Bell's palsy, which is a different cranial nerve.
It's a dead feeling to the face.
And that your seventh cranial nerve doesn't work well, and then your facial nerve. And then he has a problem with his left side of his tongue didn't work.
Yes.
And he when he lost his taste and
gag reflex when brushing his teeth.
Gag reflex.
And what was he?
And he had night sweats
he was
every
hearing,
night.
Hearing something weird.
He had poor hearing in that left ear. And so this is what happens, okay? Because to keep it simple, the good Lord made us with a bunch of wires that are really tightly packed in our body, in our head, called the cranial nerves. And if you've ever had in our house, there's in the kitchen we have, when the kitchen GFI goes out, there's something down all the way in the basement that they just have a run.
I have an older house, same thing.
And we have one of those runs with our eyes that comes out of our hypothalamus, and that's kind of like the middle of your brain, and it goes to your pupil. But in order to do this, it goes all the way down to your cervical vertebrae, out over the top of your lung, up your carotids, and there's 3 different neurons. And so basically, we have to know as eye doctors about we can diagnose lung cancer and carotid problems because of a pupil problem, and it's called the Horner syndrome. So I think the good Lord was getting paid by the foot on these wires. But at any rate, so this gentleman, get back to this gentleman. So he comes in 2 days prior with his daughter for eye care, and I look at him and go, hey.
He came in with his daughter, so he didn't come in to see you specifically.
On Wednesday he came in,
and
with his daughter, and we've seen him once in the past. Nice, fantastic guy. And so he's sitting there with his broken face, and I'm an eye doctor, and his eye won't close. And he's developing a keratitis, and so I have to go do eye doctor things. Well, the fact is, in treating the tightly grouped wires, by the time I do my job of treating his eye problem, it bleeds into everything else that's nearby. And so he came in on Friday, and it's interesting. I'm showing you a device we're using for a protocol, a study, and we're still looking for macular degeneration
Very
patients.
Simple battery-operated device.
It's a battery-operated device that emits frequencies, and this was one of the tools that we used for him. And so he came in, and in 2.5 hours of work on just putting this frequency through him, using some ozone, some activated oxygen, using some magnetic fields. And that night, everything washed away. His taste is back. His tongue works. His face was recovering.
His smile was
recovering. The pictures show it. So he had no more night sweats and so on and so forth. So all these entering symptoms were relieved because in order to go treat the things that go to the eye, I kind of surmise that his cranial nerves, that we have 12 of them, probably 5 through 12 were affected by the area of it's kind of like a concussion. You know, when you get a concussion, you have a subthreshold contusion. It doesn't show up on the MRI, but your body's jacked up. And depending upon what part of the brain is not happy, then you're going to have consequences.
Right.
And so this guy had all these consequences, and he's one happy character. So I saw him on Friday, had him stop by on the way to work on Monday. I take pictures of all this stuff. So I got all these pictures pre, peri, and post every day. And then he came by yesterday for some more energy work. And energy is all these things I talk about.
Basically, this is energy maintenance.
Yeah, because look at you go to your cardiologist and they look at the energy in your heart. You go to your neurologist, they look at the energy in your head. You go look in your blood. You have magnesium and sodium and chloride. They all have hydroxy groups. They have positive and negative charges. We're nothing but energy. And comes in different forms. And when our batteries are down, when our batteries need to be charged, because we've been insulted by this virus who's zapping us, you got to go charge things back up. And that's a silly but simple and truthful way of looking at it. And I am not smarter than third graders. So I got to call them all the time. But it just keeps it simple. We're full of wires. We're plumbing. We have chemical plant we're full of, and you've got to get it in sync. And so this gentleman had an infection that caused a loss of his capacity to fight off things. Like right now, you and I are fighting off all these viruses and bacteria and stuff, and it just sickens me.
That are constantly on your body.
People think that the only way they get COVID is one person walked by them with COVID and they got it. It's like, no, your body's fighting these things off all the time, and that's why being healthy and having a good immune system will let you navigate life without all these problems. Now, there's a tipping point where we get too many zombies over the wall, and then they win the battle, and then you got to fight them back. And so as an eye doctor, dealing with the part of the brain that's called the eyes, I know to reach out to the greater area because that's what you have to do. So the good Lord had this wiring map in this panel box that's all crowded. And once you start doing these things, you start finding out that you have these positive outcomes with related and nearby structures. And it's great. So
let me backtrack a second and ask, because I think it's amazing, and I'm not sure a lot of doctors would do it. But and this is the impression that I have, and I may be wrong. But this gentleman brought his daughter in for an eye exam.
He's a patient, but I've seen him in a year.
And he was sitting out in the lobby.
He was in the exam room,
Okay, and you noticed these problems, and you said, "What's going on?"
Yeah, sure.
And then you said, here's what I think. Could we try some things?
Well, right, because in the global view, I've been working in the area of BES, bioelectric signals, for a long time. And when you do this stuff, you start learning a bunch of things. And when you're working in this, you find out it works on that as well. And I'm an eye doctor, and I stick to eye stuff. And he had an eye problem. His eye wouldn't close. So I get to raise my hand and say, I can help you. And there's considered ways of doing it and less considered ways. And he trusts us, and we did it. And lo and behold, he's a happy camper. That doesn't mean it always works. I never, ever promise positive results to anybody when it comes to this, because but usually when you find out that you can do it, usually most of the time, and then you can forecast success with people. Sometimes we fix things. We have these concussion patients that you fix them in a visit or you fix them in 6 to 10. And but people, myself included, I want to have results because I don't have the time for 22 visits, and I also want to believe. Okay, so I'm a blitzkrieg guy. I like to say, well, let's do this, and that, and I understand how it works. But sometimes you don't know which which of the modalities is the one you need to take care of first. In this simple way, I think it's kind of like, imagine that there's a big dance party and you have people from 2 years of age to 90 years of age. All different genres of music are being played. And so the 2-year-old likes the Care Bears song or whatever is popular with 2-year-olds, and the 90-year-olds are like in Lawrence Welk. Mm-hmm. And so the fact of the matter is, if you're at this dance and you and your wife are there, you got your favorite song. That's the one you respond the most to. We have proteins in our bodies. We have molecules that stand up at 2 different songs. So you have the top 4 songs in your life, or frequencies, or resonances, okay, or signals. And you have the one that makes you the most happy, the second most happy, the third most. So if you know what those songs are or those frequencies, and you expose them to the brain, body, eye, whatever part you need, then you start expressing these proteins. And these proteins, if it says stem cells come here, then stem cells come there. And stem cells now are going to fix things. If it says this vascular endothelial growth factor comes, which helps make blood vessels, okay, and repair them at the right ratios, then that's going to help cure it.
All right.
And hold on. However, I'm not a rap music guy. If you put rap music out there, I'm going to get up and leave the dance. So it's a negative response that happens. And so somebody else likes it. So what you have to know is which proteins like which signals, and every signal, every protein and molecule doesn't like something. So it makes it not populate itself and not express itself. And so there's this very complicated yet simple dance, okay, of the music and so you and your wife are a protein that express stem cells, and the other kid over there likes, does something else and propagates these other healing qualities. And that's where the science is going. That's where it is, and that's where I'm hanging out, because all of us are going to be treating ourselves this way, because there's people in laboratory and clinical studies, and that's what I'm doing as well for the eyes, we're fixing things, and it works.
The device that you brought in, so when you hook this up to somebody that may need this, you are not putting in specific frequencies in the beginning. You're experimenting with frequencies to see what works?
We program what frequencies are coming out of this.
Right.
Because we know. And so as much as I say I'm not sure, I am very well sure in other regards. But you're just inviting people to the healing dance, and you're putting in their favorite notes, tunes, and songs, so that you get the.
That was very good, by the way. I followed that all the way.
Because I have to communicate with people all the time as efficiently and effectively and quickly as I can to take a very complicated thing and try to make it simple. So that's what it is. For me, it's a dance and songs. So these are microamps. So when you go to the physical therapist and you get a TENS unit, that's in milliamps, and this is 1,000th of the strength, or 1,000 times weaker. Because like if I shake your hand right now, unless you rubbed your fingers, your shoes on the floor, you're not going to spark me. Mm-hmm. I don't know that. So we have very, very docile electricity running through our body all the time. And so the way you fix docile is with docile. And now if you have a heart attack and you're dead on the floor, they're going to, everyone back up, right? Because you need more. And so a lot of this treatment, and the eyes are very, very sensitive, and just very sensitive. And so we have to use the docile amps. But it takes a while. When you tell somebody you got to sit here for an hour and just close your eyes and do that, okay, so enjoy your problem then, as far as this goes. But
again, going back and always reminding everybody, Dr. Wilcox down at the Point is an eye doctor. He does eye exams. If you want glasses, I know a couple just came to you. Both of them came to you and got glasses recently. That's what you do.
Yep.
If you want contacts, fine. You have a lot of different treatments, like what is the one with the Vision 20/20 during the day?
Oh, orthokeratology, neurolenses.
Amazing.
The good news is I'm redoing my website, and it's a big pain in the butt because there's a lot of words and pictures and all this sort of stuff. So when you go there, Right now, it speaks to mostly being a traditional eye doctor with some other things, and you're going to see the things that I do.
But the bottom line is he is a traditional eye doctor, too.
Yeah. The number one thing we do there is the same old stuff everyone else does.
Is it really?
And lens grafting.
Okay.
Because people come in, they need glasses and contacts. And then, I've designed 4 sets of scleral lenses this week for people with blinding eye disease, corneal diseases, and they can't see. So I do the routine and the non-routine, and love it. I would just go nuts if I had to do the same old thing all day long. I quit,
So stop by Dr. Wilcox's office. We got to set up. You're coming in next week, right?
I believe. I have to go look. Maybe it is.
I think so.
Okay.
I'll look.